Millions of people throughout the world are impacted by the common health issue of breast cancer. Paying attention to signs and symptoms is one method to spot breast cancer, and early detection is essential for effective treatment. This article will examine the symptoms of breast cancer and the many signs that may require further medical treatment. Chapter Table of Contents. The importance of early detection, common breast cancer signs and symptoms. Modifications to breast texture. Unaccounted for discomfort or pain. Anomalies of the nipples. Skin alterations. Symptoms of lump formation are less common. Redness and swelling. Blunt discharge. Risk factors for lymph node enlargement. Age and gender. Family background. Replacement of hormones. Regular self-examination and screening seeking medical guidance. Treatment options for breast cancer diagnosis. Impact on emotion and psychology. Coping techniques. Networks of support raising breast health awareness. Behavioral modifications for prevention. Conclusion. Introduction. The second most frequent type of cancer in the world is breast cancer, a tumor that develops in the cells of the breast. Breast cancer primarily affects women, but it can also affect men, albeit less frequently. Understanding the warning signs and symptoms of breast cancer might be crucial for early detection and effective treatment. The value of early diagnosis. The likelihood of effective therapy and a favorable prognosis for breast cancer are greatly increased by early identification. Regular self-examinations and screenings are essential for spotting any anomalies early on, when the condition is easier to cure. Common breast cancer symptoms and signs. Modifications to breast texture. Some people find that the texture of their breast tissue has changed. This may show up on the skin as dimpling or a puckering appearance. These alterations may happen as a result of cancer cells tugging on breast ligaments. Unaccounted for discomfort or pain. Breast cancer may be indicated by persistent pain or discomfort in the breast or underarm. Even while not all breast cancers are painful, any unexplained discomfort needs to be checked out by a doctor. Anomalies of the nipples. Nipple changes, such as inversion or abrupt departure from the normal position, may indicate underlying problems. Furthermore, skin changes near the breast may be concerning. Skin alterations. Breast skin affected by inflammatory breast cancer may develop redness, swelling, and warmth to the touch. These alterations may look like an infection, but they need immediate medical intervention. Lump development. The presence of a lump or thickening in the breast or underarm region, possibly the most well-known symptom, should never be disregarded. Even while not all lumps are cancerous, it's still important to have them checked out by a doctor. Lower frequency symptoms. Redness and swelling. An underlying problem may be indicated by unexplained edema or redness in the breast or even on the chest wall. For an accurate evaluation, consulting a doctor is crucial. Blunt discharge. While there are many reasons why nipple discharge occurs, including infections and hormonal changes, persistent or bloody discharge calls for medical attention. Increased lymph nodes. Expanded lymph nodes under your arms or near your collarbone may indicate the spread of breast cancer. Factors associated with risk. Risk factors for breast cancer include the following. Age and gender. Breast cancer is more common in women, and the risk rises with age, particularly after menopause. Family background. An increased risk can result from a family history of breast cancer, especially in close relatives like moms or sisters. Replacement of hormones. Hormone replacement treatment, HRT, used for an extended period of time may make some types of breast cancer more likely to develop. Self-assessment and routine screening. Regular self-examinations and participation in screenings are essential early detection strategies. While screenings utilize mammography and other tools to detect cancer in its early stages, self-examinations enable people to spot any changes. Getting medical help. It's critical to get early medical treatment if you observe any persistent changes or discomfort in your breasts. A medical expert can carry out the required tests and offer advice on what to do next. Detection of breast cancer. Imaging procedures like mammograms, ultrasounds, and biopsies, in which a small tissue sample is extracted for study, are frequently used in diagnosis. Therapy alternatives. Plans for treatment can change depending on the stage of the cancer and the patient's health. Surgery, chemotherapy, radiation therapy, hormone therapy, targeted therapy, and immunotherapy are all potential options. Impact on emotion and psychology. A diagnosis of breast cancer can have a significant emotional and psychological effect. Patients could feel scared, anxious, or depressed. To be emotionally healthy, you must seek emotional support. Coping techniques. Keeping lines of communication open with loved ones, participating in support groups, learning relaxation techniques, and getting professional counseling are all examples of coping tactics. Support networks during the cancer journey, friends, family, support groups, and therapists can offer much-needed emotional and practical help. Breast health awareness promotion. For early detection and to lessen the effects of breast cancer, it is essential to raise awareness about breast health and the need of routine tests. Behavioral modifications for prevention. Living a healthy lifestyle can help lower the risk of breast cancer by promoting regular exercise, a balanced diet, limiting alcohol consumption, and abstaining from tobacco products. Conclusion. For early detection and better results, it is essential to understand the signs and symptoms of breast cancer. The important practices include routine self-examinations, screenings, and seeking medical counsel for any changes. By staying informed and proactive, individuals can play an active role in their breast health. FAQs. Do women alone need to worry about breast cancer? Men and women can both develop breast cancer, albeit women are more likely to do so.